And we now have Dr. Pat Turner. Patricia Turner is a laboratory animal veterinarian and pathologist who works as a corporate vice president, global animal welfare for Charles River Laboratories. In this role, she is responsible for assessing welfare risks and developing global animal welfare policy and related training. She is also a university professor emerita at the University of Guelph, where she worked previously as a professor and program leader of laboratory animal science in the Department of Pathobiology. Her research group explores refinement of pain detection in research animals, refinement of behavior management programs for research animals, as well as impediments to human behavior change to enhance research animal care. Dr. Turner is currently vice president of the American College of Laboratory Animal Medicine, immediate past president of the World Veterinary Association, and an author and editor of many academic publications on animal welfare and ethics, laboratory animal science, and small mammal pathology. She will be presenting on practical application of cumulative endpoints. Welcome, Patricia.
Great, thanks so much, Pat. Can you hear me okay and see the slides?
Yes, we can.
Okay, perfect. Thank you. Well, I'm not sure if this will be as exciting as Georgia's, but I very much appreciate the opportunity to come and speak to this group today. And as was mentioned, I'm going to be talking about cumulative endpoints. What are they and how do we apply them in practice? So just to provide a little bit of background, when we were preparing this paper that's referenced in the bottom right-hand corner here, we conducted a scoping survey using the CompMed listserv that was still around at that time to look at questions around quality of life, cumulative use of research animals, and humane intervention points. And I've just pulled out a table from that paper that I have that has some of these questions. And I'm just going to go through this just to give you a little bit of background. So we didn't have huge numbers of responses. This represents, I think, around 160 responses, of which about 2/3 came from the US, and then others came from Canada and Europe as well. But the first question looks at my institutional animal ethics committee has a guidance document for determining animal disposition at study end that includes the use of objective metrics such as number of studies conducted on the animal, number of needle sticks, study days, protocol invasiveness, and so on. And you can see about 1/3 of the respondents indicated yes. And that would sort of be addressing aspects of cumulative use. The second one asked, my institutional animal ethics committee has established adoption or retirement criteria for species regardless of study use. About 25% indicated yes. The third question, my facility has an assessment protocol for scoring animals exhibiting aversive behaviors to procedures, such as vocalization during blood collection, excessive struggling, and so on. Again, a little less than 1/3 indicated yes. The next question, my institutional animal ethics committee periodically discusses quality of life, of aging, and long-term housed research and teaching animals. About 74% said yes for that. And the last question, animal care and vet personnel at my facility regularly review quality of life and endpoint decision-making for aging and long-term housed research and teaching animals. And a little under 20% said yes for that. So these were interesting because these issues of cumulative use are certainly widespread. Lots of AWICs, institutional animal care and use committees, discuss these issues, but in terms of developing policies on them, we've been a little bit slow as a community to really be looking at these a little bit more actively. So what I'm going to talk about today is I'm going to start with some definitions. It's really hard to tease apart cumulative use and cumulative endpoints from other endpoints that we use a lot in our research, those being study endpoints, which has been shortened as SEP in places, or humane intervention points, which I like better as a term than humane endpoints. And I'll discuss why shortly. And I'll talk a little bit about setting and monitoring these scientific endpoints and humane intervention points, as well as estimating cumulative use of research animals and how that might also impact endpoints. I'll talk a little bit about considerations for research animal quality of life, because all of these factors, of course, play into that. And then I'll really talk more about sort of areas where we really need to be thinking about this more. So the imperative to avoid severe suffering and refine our humane intervention points and consider cumulative use. And then at the end, I've got some examples of how we can think about putting cumulative use and cumulative endpoint decisions into practice at our institutions. So let's go ahead and start with, thinking about the scientific endpoint. And hopefully these will be familiar terms that people will resonate with people. Certainly they're ones that are discussed in the guide, but the scientific endpoint is the earliest point at which the scientific objectives of the study are complete. And certainly we have an ethical responsibility to identify the earliest possible time to reduce the potential for adverse animal welfare impacts and suffering. We know that the scientific endpoint really needs to be defined within the animal use protocol, and researchers need to constantly refine and validate these scientific endpoints, and the Animal Ethics Committee, or AWIC, must continue to press for this. If we don't know what the scientific endpoint might be, and this can happen, then really this is the point at which pilot studies really should be conducted. And those can focus on welfare-specific endpoints, not really about gathering scientific data at that point. And those results then of the pilot study should be presented back to the Animal Ethics Committee together with the plan for the definitive study. The appropriateness of that scientific endpoint really needs to be weighted within the protocol. And there's, as we know, both an ethical and scientific imperative to avoid unexpected mortality. In general, those animals that may be found dead on a study are frequently wasted data from those animals, because animals may be found many hours after they've died. Tissues and other samples from those animals may not be useful for further investigation. On the other hand, humane intervention points, which are also known sometimes as humane endpoints, they describe the criteria that when met, require an intervention to address negative welfare states. And I like the term intervention points because it's not necessarily euthanasia that's needed at that time. There are multiple options. They could be changing an animal's physical or social environment, providing supportive care or treatment, providing additional pain relief, removing an animal from a study temporarily or permanently, or it could be euthanasia. And of course, humane intervention points should occur as early as possible to really maximize the 3R's impact. And from that paper that I mentioned at the beginning again, we also, in our survey, looked at the different intervention points that facilities use, and people could, of course, talk about more than one, but you can see that adoption, in terms of what happened to the animals at the ends of the studies, adoption was an option for dogs, certainly in a great number of studies. For farm animal type studies, slaughter might be an option. Animals, could be used for training. If it was a non-terminal study, then those animals, which would not be naive, could enter into the training colony and be used for more time. In some cases, animals might be reused on other studies. They might be returned to source, or they could be retired or sent to a sanctuary. So there are a number of options. Again, the key point is that they need to occur as early as possible. These humane intervention points, of course, also should be documented and approved by the Animal Ethics Committee, or AWIC, and then they require monitoring by research and facility personnel, and people may need to be trained. Sometimes when discussing projects with people or doing assessments and visiting facilities, when asking about humane intervention points, people may bring out the SOP that has 6 or 9 pages of possible intervention points that could be found. And it's really important that these be made project specific. So it's not good enough to have an idea, a general idea of what an endpoint should be for a study or an intervention point. They really need to be quite specific. And these humane intervention points should also be used when things happen unexpectedly on studies. These humane intervention points really need to be followed as well. So after discussing these scientific endpoints and the humane intervention points, this brings us really then to think about cumulative use and endpoints for research animals. And cumulative use really refers to the whole life experience of an animal that's brought into the research facility, including the psychological impact of being there, of being worked with, and other aspects. And when we talk about cumulative endpoints, that refers to threshold values after which procedures should be discontinued and at least a rest, if not something more permanent, be provided. And I'll provide an example of this towards the end of the talk. To really think about cumulative use, we need to think about all of the welfare impacts that are occurring for animals. And Dr. Mason, the last speaker, really brought forth some of those. Just housing animals in what we might consider to be a standard way in a research facility might be quite stressful. So the time that the animals spend being housed in the facility is all part of our cumulative use considerations. Animals certainly shouldn't be held in a facility indefinitely and without a clear plan or purpose, because there is an impact on them being held in the facility. And even time spent on holding protocols should be considered in this use, because there can be aggressive interactions between people. There may be frustrations, boredom, other aspects of the animal's well-being that aren't being met during those times. So what are some examples of these for considering the impact of procedures and determining cumulative use? And one of the most basic is just the health of animals. We may be bringing animals in that have a genetically determined susceptibility to a particular condition or a disease, and that might progress over several months. So we need to, of course, consider that cumulative impact. We need to think about the ability for an animal to care for its offspring. Again, if it has a deleterious phenotype, it may have reduced ability to care for offspring, and what's the impact on the breeding animal and the offspring for that. The level of habituation and training of animals and their responses to people are really important when we think about cumulative use and cumulative impact of things that we're doing. So if animals are struggling, if they're not really prepared for the work that's going to be done, then there can be very significant stress, and they'll be fighting and really trying to avoid being handled. And so these things are really important then to reduce the welfare impact. Changing social situation. So sometimes bringing animals in, holding them in pairs or groups for a while, and then resorting those animals to randomize them onto study at a later date can also have a very significant impact on animals. We think about that with pigs, and of course, very significant aggression that we can see when those animals are remixed after a certain age, and the cumulative impact of that. The skill or experience of people working with animals is another important factor. So we think about a teaching animal that might be a technique or multiple techniques practiced by different individuals with differing level of skill, and what the cumulative impact of that is on those animals. The number of previous uses and the time since the last use. What's the cumulative impact on an animal that might be used in a pharmacokinetic study that has 10 bleeding time points, and that animal is also being given maybe some kind of test article that also has a clinical impact on the animal. The bleeding point 9, when maybe the animal isn't feeling well, and the research group is trying to collect blood, and it takes 2 or 3 pokes for that animal. What's the cumulative impact on that animal? Then in general, of course, the physiologic, psychological, or behavioral status of the animal, as well as the ability of interventions to rectify welfare impairments. So these are all examples of considerations that could be used for determining cumulative use and cumulative impact of research protocols, research and teaching, I should say. So again, just to recap, for these scientific endpoints, humane intervention points, and thinking about cumulative use, this is all why we need to have a clear plan in place for monitoring animals. This monitoring isn't the responsibility of one group versus another. It's a joint responsibility for those working in the research facility. So it's the research team, the veterinary professionals, and the animal care personnel are all part of this. And the researchers in the veterinary team should develop clear criteria for monitoring animals together. And these need to be communicated and must be transparent to those who are caring for animals. The criteria for communicating and carrying out the humane intervention points, they need to be identified. And more frequent monitoring of animals is needed when the welfare impact will be high. And that brings into consideration, again, these concepts of cumulative use and cumulative impact. So this is just an example. This is one from my own lab from a number of years ago. This was a study looking at a new virus that had recently been identified in companion rabbits. And so we were trying to characterize the virus a little bit more. Many people will be familiar with these types of clinical assessment score sheets that talk about scientific endpoints for these animals, the monitoring that might be needed, and how to do the assessments in them. But I just want to point out here that even as part of this is for the definitive study, we had conducted a pilot because this was a novel virus and we really didn't know what the impact would be, and we were trying to figure out the right dose as well to be giving naive rabbits. We recognized in here from the pilot that these animals were quite fragile for the first few days after injection. And because it was a virus, we did expect to see increases in body temperature, but we know that rectal temperature collection in rabbits can be quite stressful. So we only did it for days 1 to 4. And similarly, picking these animals up, even though they were habituated to handling for 2 weeks prior to the study being started, picking them up when they were already sick might be a cumulative stressor for these animals. And so we tried to balance the need for gathering data with what the impact would be on animals. And I just use this again as an example of how we can bring together considerations for cumulative use, humane intervention points, as well as the scientific endpoints for these. And that's just the second part of that study. These concepts are really nicely covered in a graphic that the Canadian Council on Animal Care has put out in their revised guidelines for humane intervention points and considerations for cumulative use. So before starting the study, we think about the scientific endpoints and choose the humane intervention points and develop the animal monitoring regime, like that clinical score sheet I just showed you. During this study, we monitor animals as they progress through their scientific activity. We try to make sure that we're being consistent in using these scoring lists that we developed, apply interventions as needed. So these are the humane intervention points, and then adapt the endpoints, the scientific endpoints and the humane intervention points as required when there are unexpected outcomes. All of this being documented. And then after the study, there's a retrospective analysis to evaluate the effectiveness. How well did those scientific endpoints and humane intervention points come together, and use this information to guide future studies. And this is the process that many facilities, will follow routinely. We can begin, though, as we think about this issue of cumulative use of animals and the impact and interventions that we may be doing with animals, we can use these actually to ask ourselves, can we do better? Can we do something more prospectively when we are working with animals, again, to try to enhance aspects of the welfare? for those animals. And that's where this issue of quality of life considerations for research animals can come in. Animals, rodents, fish, the species we work with are sentient. They're not just sort of objects or a black box for research to be conducted in. And it's important that we think about the lived experiences of the animals that we are working with when we are thinking about the welfare impact of the research that's being conducted. This table is one on quality of life considerations for research animals that, again, it came out of that paper that I mentioned at the beginning that we did. And this quality of life, of course, refers to how an animal is living within the research facility and coping with the various interventions and the research procedures and other things that are occurring with that animal, as well as how it's being housed and cared for. So there are a number of different categories in here. We have 5 categories listed that start at the bottom, of course, with a life not worth living, moving up to a life worth living and a good life. And in the middle, this point of balance where the positive and the negative experiences for that animal are equally balanced. And of course, I would be arguing that we should certainly be moving away from animals being kept in a state of a life not worth living or a life worth avoiding to this point of balance, and in fact, increasing to a life worth living and a good life, as we think again about our considerations for research animals. So we can apply cumulative use and cumulative endpoints to all of the work that we do with the research and teaching animals, but probably the most salient area to be addressing first are those studies where we can have severe suffering. And so I want to spend the next little while talking about how we put some of these principles that we talk about with scientific endpoints, humane intervention points, and cumulative use and cumulative impact considerations into thinking about models with severe suffering. We use, in North America, we tend to use the term invasive protocols more than the term severe suffering. However, that's a term that's used a lot in Europe and the UK. So severe suffering, what do I mean when I talk about this? This is severe pain, suffering, or distress that an animal may experience on a protocol. It also refers to long-lasting moderate pain, suffering, or distress, or severe impairment to an animal condition or its well-being. And it's estimated that approximately 10% of animals used in experiments around the world will experience severe suffering as part of that protocol each year. So that's roughly somewhere around 10 million animals. And an argument, really can be put forth that this isn't really rocket science, but it does require us to really focus and champion a consistent approach as well as knowledge of what our current practices are. And again, this isn't a new concept. This has been published for almost 10 years, this concept of reducing severe suffering. There's a very nice website that is sponsored by the RSPCA UK that talks about the severe suffering roadmap. And I just mentioned this here. I'm not going to have time to go into it in huge detail, but it's a very helpful resource as IACUCs begin to think about this and people begin to think about these sorts of issues. So when we think about causes of severe suffering in animal use protocols, we can think about 3 main areas in which this can occur. There are certain procedures or models that are more likely to cause severe suffering. So a lot of our neurologic models that cause severe neurologic impairment, animals may not be able to eat or drink normally or care for themselves. These are models in which those can occur. Models of congestive heart disease in animals as well. If an animal dies on a study, this may involve severe suffering for that animal. And that's why we place so much emphasis, of course, on monitoring. And this includes both unexpected death and those protocols in which death may be an endpoint in the experiment. And then the other cause of severe suffering can be the cumulative impact. So that's when a combination of less severe factors, when they're all brought together, it leads to increased overall suffering. So I've shown this roadmap right here where we take the culture. So this is the desire by the institution to do better, to reduce the impact of severe suffering, these protocols, and then the 4 steps that come from that. And this has been expanded in this particular graphic right here. So this is really demonstrating what steps need to be taken to engage the local research community, but also caregivers and the AWIC as well. And I'm not going to go into this in huge detail. Again, I'd really encourage people to take a look at this website and really think about these different aspects. Just wanted to show you that we have the analysis portion. I'll talk about this a little bit. The evaluation, where we can identify issues, and then really thinking about that overcoming obstacles. The cumulative effects piece, this is right here in the model, in the middle of the model as well, where we think about the animal's lifetime experiences, identify non-procedure effects, and the effects of scientific procedures to lead us to refinements. So I'm going to talk about the analysis piece in a little bit more detail, and then provide some worksheet examples where we can look at how can we really drill down and look at some of these concepts a little bit more thoroughly. So when we think about analyzing protocols, again, this approach could be used for any of our protocols, but probably it's going to be most impactful when we select the protocols that are of higher severity. So this is just really taking a risk-based approach for these. And I would suggest that this is a team-based approach really would be most effective for this. So this is about including scientists, the veterinary professionals, animal technicians, and care staff as all part of this. This isn't about picking on particular researchers. This is about working together collaboratively to really improve the outcomes for a particular study and to really refine the protocols. The group could be the Animal Ethics Committee or a subgroup of that. It could be an opportunity for a post-approval monitoring group as well. So which specific group is doing this, I'm not going to specify. That's really up to the institution. And there needs to be a clarity in the purpose. It's really about reducing the severity of the impact on animals. And then the outcomes for this will be then records of decisions and actions that will need to be taken by the research group, by those caring for animals or the veterinary professionals or others. And, you know, an example of this could be a very severe arthritis model as shown right here. What types of protocols should be thought about for focusing on these? Things like batch potency testing of biologics like vaccines, infectious disease models that have severe signs, studies of diseases that cause severe suffering in humans like rheumatoid arthritis, sepsis, and spinal cord injury, some regulatory tox tests like acute toxicology or ecotoxicity, and then animal-specific diseases and disorders that like that rabbit one that I mentioned before, protocols in which animals are commonly found dead, because that usually means then that there are interim issues occurring that may be contributing to this. And any protocol basically that is raising specific welfare concerns at a facility, or where the IACUC or caregivers or others, the research team feels that more could be done to reduce the harms to those particular animals. Those are ones that the facility could use to focus on. This starts with an evaluation. So that analysis evaluation is the next step in there, maybe looking for humane intervention points and refinements that can help to avoid death. And this is where record keeping really needs, is really helpful and needs to come into play. So those score sheets that I talked about before, Sometimes those are used quite a bit during a pilot study or during the initial phase of a definitive study, and sometimes the use of those can fall off as people become a little bit more familiar with the protocol. Unfortunately, we lose a lot of data if we don't keep up with some of that monitoring at least. So having those welfare assessment records can be really handy for these types of studies. If animals are found dead or have to be euthanized, it's important to review and see whether there were any indicators or refinements that could be used to prevent further death. So for example, in this case right here, seeing that there was a significant drop off in body temperature might be a cue then to provide more nesting material or a different type of nesting material so that animals could maintain warmth and try to prevent this loss in body temperature, which can lead to death. Body weight losses or body weight gain suppression, difficulty in rising or moving, and how we might be able to bring food and water closer to those animals as a refinement, again, to help to avoid death. So these are just some examples of some of the evaluations that can go in and be discussed. This is also the time when we need to think about the cumulative experiences of the animals that are in the facility and in that particular study, and really think about refining those. So may include aspects of how those animals are being bred and managed, if they're captured from the wild, restraint stress, other things that these animals might experience, how animals are transported and how well we rest those animals. In many facilities, there may be just a 2-day acclimation period after transport for species such as mice and rats, whereas there's at least a 2-week acclimation period for dogs and primates. And we make a lot of assumptions about what might be okay for these animals, but we certainly differentiate by species. And I'm not sure that it's always there's always a good rationale for that. How we mark animals for identification, or we microchipping them, the stresses that might be involved with anesthetizing those animals, using a large trocar to put a chip in, for example, the restraint that might be involved, tissue collection that might be done for genotyping, the housing practices, as was just mentioned by the previous speaker, and the stress that might be causing chronically in animals, various husbandry procedures for animals. Are we transferring nesting material, for example, with mice or not? A speaker yesterday talked about handling and restraint and the impact on animals and how we can refine those. The different scientific procedures, are there, if we have 2 major activities occurring on a study, can we lump those together so that the animal only needs to be anesthetized or restrained once, instead of maybe having one occur in the morning and one occur in the afternoon? And what are the impacts of those procedures on animals? Do they have enough time to recover between them? So non-invasive imaging has been fantastic for sequentially monitoring tumor and other changes in animals. But if it requires daily anesthesia, do those animals have enough time to get nutritional support in between bouts of anesthesia? And then, of course, humane killing and adoption and rehoming processes afterwards. So these are all actually little pieces that, again, this is the sort of things that we just do routinely that maybe we haven't really analyzed to see, are there better ways that we could be doing this? And this graph here on the right sort of demonstrates what the impact can be from some of these cumulative experiences. So an animal may undergo a procedure, as shown here, and it has enough time in between to recover from that procedure. And so it's back at baseline again. And then it undergoes another procedure, but insufficient time is given before a third procedure may occur. And this is where it kind of may push the animal over into this severe suffering point right here. So this is why we need to look at some of these procedures in a little bit more detail and think about the cumulative impact that may be occurring on an animal. Okay, so this is a worksheet that I've modified a little bit from this website here, where we can start to think about estimating the cumulative experience of animals. And it's really about thinking about the experience for the animal, the welfare issue, and the ways that we might be able to mitigate some of these things. And I've listed some common factors that animals may undergo here on the left-hand side in this column. So where the animals might be sourced from, how long they're transported, the marking that might need to be done for identification, whether additional genotyping needs to be done for them, how we house those animals in the environment, the husbandry and care, handling and restraint and other procedures and things, and how we euthanize them. And I've started to fill this out then for, let's just take this example then of a mouse tumor study, and I'm being very general right here, of how we could start to think about this when we estimate the cumulative experience. So again, the event or procedure is in the left-hand column. What the welfare experience might be like for the animal is in the middle column. And then the mitigations, what we could think about doing to reduce the impact on mice or to improve their welfare. That's on the right-hand side here. So for example, ear notching for genotyping and identification. That might be the procedure that we need to do. What's this like for the animal? What are the pieces for this? Well, we catch them, we restrain them. That could be uncomfortable. We know the ear notching will be painful, even though it's short and it's just a small piece of tissue. What could we do to reduce the impact? Maybe think about using a non-aversive handling method instead of picking the animal up by the tail. Make sure our equipment is sharp and we can do it quickly and efficiently, and that we have the skills to do it quickly. And or think about using a non-invasive method such as a saliva swab. And this technology has been around for at least 8 years and has been very well validated as well. And I haven't filled this out. This is more kind of a workshop opportunity for people to think about, well, what are some of these other things that we could be doing? What's the impact on the animal? And then how do we mitigate it? So this can be done. This can be done in general, thinking about things, or with a particular study. Thinking about a particular procedure and the impact of the cumulative impact of that. This worksheet can help with this. So again, asking the question of what does the study involve doing to the animals? What will the animals experience and how much suffering might it cause? What might make it worse? And how can we mitigate that? So what are the methods and interventions we can use? And if there might be suffering, then what will be the specific humane intervention points? And I'd like to just go through an example of this using the transient middle cerebral artery occlusion model, which is a common rodent model. So it's used in both mice and rats. But I want to talk about a real life example with this. So the TMCAO stroke model is a unilateral non-hemorrhagic focal ischemia perfusion injury. It's surgically induced. This is just a little graphic from a paper on this that shows aspects of this in the mouse. The model has a high construct validity because we know that a lot of human patients that suffer an ischemic stroke, it's caused by transient occlusion of the middle cerebral artery. But for anybody who has one of these models or multiple of these at your facilities, you know that the drawback from this is that it can be a very severe model, and there can be very significant differences in the lesion size, and that's part of what contributes to some of the clinical signs and the challenges with managing these animals. So I want to acknowledge Dr. Thomas Bertelsen from Novo Nordisk, who worked with another facility to try to refine their model for this TMCAO model. In this model, when you read papers on this, there's very severe body weight loss. So it's common for these animals to lose up to 30% body weight, often within the first week or two after the lesion is induced. And also these models typically have very high mortality. So they can be, in published papers, up to 40% of the animals may die following the surgery. So working together with this facility, they started to look at some of the cumulative impact of some of the procedures. And that's where I want to tie it into what I was just talking about previously. And they decided to try to intensify some aspects of monitoring as well as care, but trying to be very careful not to induce stress in these animals at the same time. So knowing that these animals don't get up and move around and drink a lot in the first few days after the surgery, they decided to treat 100% of animals with warmed fluids for the first 3 days after surgery, just to ensure that these animals were well hydrated, which is part of the road to recovery for these animals. And they instituted a kid glove treatment for these animals. So before and after studies, they used low stress handling, habituated animals very well to handling and got them used to that beforehand, ensured that the bedding was comfortable. We had a great talk earlier today talking about aspects of comfort and the type of substrate material that can be used. So they had good nesting material, and thinking about social partners, which we know can help to buffer some of the stresses that can occur in some research protocols. Sometimes in these studies with neurologic studies and CNS studies, sometimes there's a little challenge in monitoring animals, and sometimes also an unwillingness to explore full analgesics with them, because people are concerned that if they give a sedative drug and an animal already has a neurologic condition, that might put those animals over the edge. But then that can mean that sometimes pain isn't adequately managed. And in this particular case, they optimized the analgesic regimen by adding additional analgesia. They added an opioid to local and non-steroidal anti-inflammatories that were already being used, and then provided also soft feed and or syringe feeding for the first 3 days after surgery, which together with the fluids was really optimal in trying to help these animals get up and around. And really encouragingly, something that was really exciting from this was that mortality with this particular model in the hands of this facility actually went to 8%, which was still higher than, of course, baseline, but very significantly reduced from that 40%. Previously, because of the monitoring schedule that was being used, they were missing low-grade seizures that might be occurring in these animals afterwards, and they were only able to see the most severe seizures that were occurring. But with an increased monitoring of animals post-op, this led to better characterization of seizures, earlier detection of them, and then decisions for earlier humane intervention points and endpoints when they weren't responding well. So I just wanted to show this. I mean, it's some of you may be saying, well, gosh, you know, there are nothing sort of rocket science again involved in this, but it's really the drive to look at these things, to systematically look at optimizing different aspects of this protocol, which led to really significant improvement and really optimized it for the research that was being done. So just to wrap up then, I want to emphasize that animal ethics committees and AWICs and researchers can directly impact the outcomes and quality of life for their research animals. But this does require a general and specific protocol focus to really identify and consider meaningful humane intervention points, the impacts of specific procedures, and to really think about these cumulative experiences of animals. This cyclical, that cyclical process that I showed you of review and analysis with implementations of suggestions, feedback, and training, this is really the process for it. And as was mentioned by a speaker yesterday, there really needs to be a drive for change and people to help drive that process. But we do have an ethical and scientific imperative to move in this direction to help avoid and reduce suffering for research animals. So thank you so much for your attention. I'm happy to answer any questions or comments that you might have. Thank you.
Thanks very much. So we do have a couple items here that hopefully you can talk about. One is someone did want to say they really liked the modification of the use of humane endpoints to humane intervention points. So I wanted to let you know that they appreciated that change. They also asked about how to measure body weight loss versus time duration. That body weight loss measurement can not always be really. I'm trying to understand what they're asking. That there's confusion and lack of evidence about the body weight loss measurement. That the loss in weight is considered, but what time duration is important to justify that the users in order to enforce animal welfare.
Yeah, they may be thinking about how much, I don't know, how much is lost over a specific period of time. When, we body weight loss, often exceeding 20% is often used as an actual endpoint in many protocols, but loss of body weight over shorter periods of time. So for example, 10% that might happen in 3 days or something, that also might be an intervention point, because even though it didn't reach the 20%, it's occurring over a much shorter time. I'm not sure if that's sort of addressing. The other thing with body weight loss is that with a lot of rodents, for example, mice and rats, we're bringing them in and placing them on studies when they're still young adults. And so we have to not just think about body weight loss, but body weight gain suppression as part of that too. And sometimes that's not accounted for.
Okay. And we also had a comment about, and this is based on building from Melanie Graham's talk yesterday. How much would you take into consideration whether an animal assents to a procedure, in other words, is offering itself, when considering its cumulative effect?
I mean, animals' ability, cooperation, I think,
Yes.
maybe
Cooperation, yes, that it's putting
yeah.
its arm out there to have the blood sample taken.
Right, and that I mean, those are really very significant indicators of an animal that may be well habituated, to the experiences, very much prepared as part of that ability to be part of that research project. So that would, I'm not quite sure what the question is, but I mean, it would significantly impact the cumulative experience of that animal, right? So it's an animal that's very well prepared, habituated, understands probably what will happen, and is, cooperating, versus an animal that's actively struggling, maybe trying to bite, vocalizing, urinating, defecating, which obviously would be indicating a very highly stressed animal. Sometimes, for the sake of a time point or some kind of procedure that needs to be done on a particular time in a study, people may move ahead with those animals that might be resisting. And sometimes there can be injuries that occur from restraint, injuries to people from bites and other things. And, those are points where we really need to step back. The research group, veterinary staff, others, really ask, how critical was it? Couldn't we have waited? And really, let's think about this and plan proactively next time if we see an animal that's really not prepared, or really struggling or resisting. It's maybe time to take a break for that animal, and that would again be a way that we can impact sort of that cumulative experience for the animal, and maybe step back from having to creating an intervention point as well.
And the person also asks about if there's a hypothetical environment or housing situation that you would think is high enough quality that the time in house that they have would no longer be a consideration. In other words, they've been given the best environment for their entire period of captivity.
Yes, and that's very. It would be great if we could do that with all of our animals. It's very difficult to do if that could be managed. So, an example of that might be at a agricultural college where or vet college, where animals like dairy cows are brought in from a pasture type setting and are used for a semester or worked with in a teaching environment for a semester, and then return to that environment after that semester is over. That might be an option for really thinking about reducing the cumulative impact of housing on those animals. So that's one example, but it can be difficult in downtown New York City to have that kind of environment that we're able to provide for all animals. It's easier theoretically to do for rodents because they're smaller than, for example, a primate. But we really have to be very thoughtful about those environments too, again, as was discussed by the last speaker.
Okay, well, thank you very much. We have no other questions at this point in time for Pat.
Great, thank you.
Okay.